What to expect during after-surgery suture removal. Have you recently had surgery and are wondering what happens when it is time for your suture removal? Let's break down the process so you know exactly what to expect. When you arrive for your suture removal appointment, a healthcare professional will begin by cleaning and sterilizing the area around your wound. This step is essential to minimize the risk of infection. Using sterile tweezers or forceps, they will gently lift the knot of each stitch. Then, they will cut the suture strand close to your skin with scissors. You may feel a slight tug as the suture is pulled out, but this should not cause significant pain. The healthcare professional will repeat this process for each stitch until all are removed. Typically, this procedure is quick and does not requiring any anesthesia. The timing for when sutures are removed can vary based on the location of the wound and how well it is healing. For example, if your sutures are on your face, they may be taken out after 3 to 5 days. However, sutures on your arms or legs might stay in place for 7 to 14 days. Your healthcare provider will give you specific guidance based on your surgery and healing progress. After the sutures are removed, it is important to keep the wound area clean and dry. You should wash it gently with soap and water twice a day. Avoid using harsh substances like hydrogen peroxide or alcohol, as these can delay healing. Your doctor may apply thin strips of medical tape over the wound to support healing. These strips will naturally fall off on their own and should not be forcibly removed. Keep an eye on your wound for any signs of infection, which can include redness, swelling, increased pain, or discharge. If you notice any of these symptoms, contact your healthcare provider right away. Depending on the wound's location and the risk of contamination, you may need to keep the area covered for several days to protect it from injury or dirt. In some cases, especially after oral surgery or major procedures, suture removal may be done gradually. This approach ensures that the wound remains securely closed. Additionally, some sutures are designed to dissolve on their own and may not requiring removal, although sometimes remnants are taken out to promote better healing. Overall, suture removal is a straightforward part of your post-surgery care. It is essential for your wound to continue healing properly and to reduce the risk of complications. Following your healthcare provider's instructions on wound care after removal will support a smooth recovery.